Something I'm seeing more commonly and significantly is how weak people's feet are. When I'm trying to help someone feel better, the biggest things I go after first are the lowest hanging fruit that I know that I can take care of that'll start making a difference as fast as possible. Something I notice a lot with people that have foot pain like plantar fasciitis and knee pain is that they have really weak feet. Specifically, their toe flexion strength is really limited. Now, I commonly use a dynamometer to measure how strong these people's feet are. And what I'm looking for when I measure the strength of the big toe and how much force they can put down into that pad is I want 20% of their body weight. And for the other four toes, when I measure them in isolation, I want 15% of their body weight in terms of the pounds of force that I'm measuring there. And many people don't come anywhere close to that. One way we can see an instantaneous improvement in foot strength is through isometrics. And there are specific isometrics that I use in a progressed series for many people to see really good results. Isometrics in themselves have a ton of benefits, but a few of the main ones are that they help improve co-contractions around the foot, the knee, and the hip. When we strike the ground when we walk, and to a greater extent when we run, we have co-contractions of muscles. This is going to allow these joints to move through space effectively with stability, and depending on where we are within the gait cycle or within running or movement, we're going to have certain muscles fire and other muscles shorten or elongate. But the idea is that this provides us stability, and isometrics help us train that. Not only that, but isometrics are also great for blood flow. So if you do an isometric and you do that for a long enough period of time, you start to get an increase of blood flow and capillary density built up within those muscles and tissues being used. Now, with these specific isometrics, we see something even more amazing happen. When we measure people with their range of motion, all the way from their hip to their shoulder, beforehand, they might be limited in range of motion. But after doing these isometric activities, we see an instantaneous, significant improvement in many people when they do these activities. Now, the reasoning behind that is relatively complex, but there is real value in this because it provides a systemic effect for getting people more range of motion. Now, these changes in range of motion may or may not stick over time, but they provide us a window of opportunity to have them stick with other types of exercises. But it is kind of cool to see what happens when you do a before and after of your range of motion. But the main idea here is to improve foot strength. And we can do that through a couple of different activities that we start people with. What I would recommend is doing these for about 2 sets of 30 seconds each and building up with that over time. These exercises are examples of foundational isometric activities that I use within my lower limb foundations program, which is a comprehensive approach to lower limb issues like plantar fasciitis and also knee pain. What we're going to do here is get some sort of step where we can have our heels comfortably off the ground, and we want half of our foot hanging off of it like this. And we want to be far enough away from a wall where we can keep a soft bend in the elbows, or maybe a little bit more, whatever's comfortable, as long as we can reference the wall, keeping our torso nice and upright. So what we're going to do to start is push our knees really far over our toes as we sink down into a little bit of a squat. Then once we feel like we're at our end range there, we're going to lift our heels up pretty much as far as they can go without losing the ball of the foot on that step. And then imagine there's a pencil underneath your toes. You're going to squeeze down as hard as you can, claw the ground as hard as you can with your toes, and you're going to hold that for probably around 30 seconds to start. What you should feel, and shaking is totally normal here, is a lot of lower calf right in here. This should be lit up, and you should really feel that start to kick on immediately, and obviously more as you go throughout the set. The most common mistakes in this activity will involve people not feeling the right things, or it won't be very hard for them. The first thing is they won't have an upright torso, so they'll lean far forward and their butt will shoot back, and they're not going to feel a lot when that happens. The other thing is that they'll be upright, but their knees won't go far enough forward. If they just have a little knee bend, you're not going to feel a whole lot. Make sure those things go really far forward, then you'll really start to feel it. And then what we're going to do is keeping the heels driven down, but not losing our foot contact in that box, we're going to drive our knees as far forward as they're going to go. That's going to bring us down to a little squat right here. So once you feel like your end range of that knee forward translation is hit, you're going to drive those heels down, and the whole time You're gonna keep that, but then you're gonna squeeze your toes and claw your toes into the ground, almost like there's a pencil underneath your toes and you're trying to squeeze that thing as hard as you can. You're gonna hold that for around 30 seconds to start. I'd recommend experimenting with both. Some people respond better to one more than the other. Other people like both of them. So you can try these out and see what happens.